So, what's up, Facebook Live? I am back here at the whiteboard, and I am going to have a special guest for you tonight, and that's going to be the one and only Dr. Abby Perone / Torrance here coming soon. She is an expert with rehab therapy, hands-on myofascial work, and some of the other things that really go on after your Regenexx procedure. So if anyone has any questions, please pop those in down below. And Dr. Perone will be on shortly once we get our little one off into the la-la land, or she's gonna jump on with him. So Dr. Perone is here, and we are going to talk rehab after Regenexx procedures. So really, Dr. Perone, welcome, and I know you've seen Regenexx procedures after the fact. Tell me a little bit what you've seen from some of your patients, some of the most common things or most common dysfunctions that they can start working on prior to that Regenexx procedure.
Common dysfunctions, so really it boils down to either a mobility problem or a strength problem. You know, if I'm just reducing it down to the most simple diagnostic direction that it came from. So a lot of people have a lot of tightness and we need to work on loosening certain tissues. And a lot of people also have the other side of the coin, which is not enough stability or strength. So those are two different sides that we could have to address.
Well, and let's talk about a patient that we've co-treated together, and somebody that comes to mind who really had one of these issues, and one of those would be, what's her name? John, I'm like, I can't put the name there, but we'll call her knee patient X.
Okay.
And knee patient X came in, and she had gotten in a CrossFit accident or CrossFit issue. I think you know what I'm talking about, right?
Well, there are a couple. Okay, keep going. I'll put it together.
Well, knee patient X came in and she had some inflammation due to some arthritis, but she really was doing a lot of jumps and things that were a little bit before her. So she started. The beautiful thing about medicine is that you've got to figure out you got to find number one, the pain generator, but then you also have to figure out what you need to do to correct that long term. That's where this mobility and strength, and I like to call it the strength and mobility axis. And some people are too strong and makes them too tight, and some of them are too loose, which makes them too mobile. So this patient, I think you know what I'm talking about now, she came in and I did our Regenexx SD treatment, so same day bone marrow aspirate concentrate treatment where your body has stem cells, and that's really what one of our, really I'd call it our flagship treatment. And she came in and got treated, and she came to see you afterwards. And what did you identify in some of her movement dysfunctions?
Just that, well, a knee is a joint that depends a lot on the foot and the hip. And so there was really a stability issue between the foot and the hip that caused the knee, which is a simple hinge joint, to just have too much stress on it. And it was interesting because her front thigh muscle, that quad muscle, was actually really tight and short, contributing to the problem, meaning that she recruited a muscle to be overused. So it was actually a combination. Her main problem was a weakness, so a strength issue, but it also manifested as one specific area was overly tight. So that's an example of, kind of a combination, but her primary issue was strength in the hip and the foot.
So what would you do, or what did you do, what did you prescribe to her at home so that she can get better really during this whole process? I know you see patients usually once a week, and then you do some things after that to make sure that you give them corrective exercise, right? So corrective exercise is a big prescription, and if done right and people do their exercises, they really will help lock in the change that we can create with our Regenexx procedures. And so what corrective exercise would you prescribe for somebody with a tight quad, which I would say 90% of people have tight quads.
Yep. Yeah, it's one of my favorite tests to do for low back pain, for knee pain, because it's low-hanging fruit. It's very common. I have tight quads, and I don't even have pain. So that's the crazy thing. It can show up it's an insidious thing that if you don't work on it, that it can turn into a problem. So it's something that I keep in check with myself. But so as an overarching theme, I like my exercises to be initially, some programs develop into more exercises, but initially I like 3 things in there, the 3 most important things for someone to do, and I call them low tech, no tech. The least equipment, the least complexity, the better. The least barrier between the patient and the exercise getting done, the better.
Mm-hmm.
So for this particular case, I usually recommend some kind of self-myofascial release. So maybe foam rolling of the quad. A lot of people like to use a gun of sorts that is a massage gun to just warm up and loosen the muscle. And then the second thing, and I would say the most important thing, is a simple hip and quad stretch. So just laying on your stomach, and if you don't have a really significant knee problem, you can do a simple quad stretch, and I think that is one of the most powerful corrective exercises that we do.
Yeah, so quad tightness is really, really a big thing that she can help with. That's something that I think every patient that I've worked with has done that. By the way, I was just typing the link in below, so if you have any questions or you want to come in and see myself for an evaluation, or you want to go see Dr. Perone for evaluation, she is back seeing patients. Even though Trippy's right here, you want to pick him up for a little bit?
Yeah, he's trying to go to sleep.
He's trying to sleep here, but he's not doing a good job at it. So time management, guys, this is something that her and I have mastered in life, is that we make sure that we get our stuff done. Now, so work on the quads, we work on the foot, make sure the foot contacts the earth. Really, I'm a big super feet fan, guys. I'm going to tell you that right now. It's because it's something that helped me personally with plantar fasciitis, because my foot wasn't contacting the ground well. And that's something that really can help and can manifest up the chain, whether it be in your hip right here, or whether it be in your low back, or in the knee, which is most times for lack of a better term, the redheaded stepchild. And I have a red beard, he's got a redhead, so it's just kind of funny. So we cross-post this to see if we can get anybody to jump on, but if you have any questions about what to do for your knee post-treatment, that's really where the corrective exercise comes in. Do some quad stretches. What kind of strengthening would you do for a patient?
So, there are times, sorry, I feel like I'm not in this picture. So a lot of times, there is local knee stuff that we need to do. We like to, I have a patient I'm thinking of that's actually a male patient with a knee issue, volleyball player, that he had very local knee weakness, and there are times where I'm like, we need to just strengthen right around the knee. But in the case that we're talking about with, some things being in the foot, some things being in the hip, causing the knee to be weak, a lot of my exercises go up into the hip. So I love like a clamshell, I love a hip, I'll just call it abduction, but like a Jane Fonda is another name we call for it, where you just do some side hip raises. That's a good one. And then definitely some foot strengthening. So
foot strengthening. I need like your midfoot. I need like your short foot.
Yep, short foot exercises. Really just moving your toes up and down is one that you can do underneath your desk. Just an alternating toe drill where you lift your big toe, keep your little toes down, and then you reverse that. And
you can use your hand to help it, because a lot of people don't do well with that. So if you don't do some toe yoga, something that I really prescribe to my patients, you can get some toe spacers to help with that. It really we love toe spacers because it helps you use your feet the way they were intended to be. The shoes are toe coffins, in my lack of a better term, and they lock your toes in and they don't let them do much, so you're just kind of moving around with hooves.
And if you take off your shoes and your toes are all I can't find my hand, like stuck together like this, that is not a healthy foot. We want to see a nice healthy splay between the toes. I actually had a patient today that I taped her great toe, her big toe out, and her little toe out, and all the 3 middle toes were able to separate, and her foot looked like a sick foot when we started, and just by adding a little tape on either side of her foot, we were able to make it look like a healthy foot.
Mm-hmm. No, those are quick little things that you can do to help with your knee pain or with your foot pain, and those are things that can really help you long term and lock in any changes that you want to make. So this is something we just wanted to touch on tonight. We always got the little baby here tonight. If anybody has any questions, I'm happy to really jump on those. But we just wanted to make sure that we when we send somebody after treatment, we send them to quality therapists. I brought on a lot of quality therapists. She's one of the squad of quality therapists we have on here. Jim Godin's been on here. He's with Exos. There's been a lot of different people that I've worked with, and that I will continue to refer to, because you have to work with people who do quality treatments, and that's something that really helps. So after the Regenexx procedure, what happens after? We have to do some corrective exercise, and corrective exercise is great. Also, myofascial work. I'm a huge proponent for myofascial work. What kind of myofascial work would you do, and what kind of techniques would you use?
I do a lot of work up the quad, so I just use my hands and thumbs specifically to get into the quad muscle, and I work from the knee all the way up into the hip, and then I retest to see if there's an increase in mobility in that particular case, and then we get down into the knee joint itself and work through the connective tissue around the knee and up into the hip and down into the foot. So kind of like what I'm saying, whatever issues I want you to strengthen or mobilize, I'm going to be working on those hands-on, and that includes the whole chain.
100%. So if you haven't followed us yet, or you have any additional questions, you can email me at ron.t@regentampabay.com. I did put a link in the questions below, so if you want to come in for an evaluation, get seen. Sorry, I didn't mean to tilt you up, but I want everybody to see that up there. And if you want to see Dr. Perone, it's Dr. Perone at lovehealth.live. You can reach out there, and I'll put a link down there below to Love Health page. But thanks for jumping on tonight. We want to continue to do these, to put out good content for our patients, so you can get back to doing what you love. Have a good night.